Hi, I'm Jennifer Jackson. I'm a registered nurse, and this video is about using Twitter for research. And I'm making the assumption in this presentation that you already know the basic functionality of Twitter and what Twitter is about. And so what I'm going to talk about is how we use Twitter to do research and how we use Twitter to promote research. This video is primarily geared for the health faculties. So my examples are about different health professions, but if you're in academia and you don't mind a little extra cognitive work, there's lessons for anyone more broadly. So I'll just share my slides with you here and we'll get started. All right, there we go. So this was originally done as a workshop at King's College London. So there's some limitations of doing it as a video in that there's not those same opportunities to practice live on Twitter, but I encourage you at different points if you want to check something out, just pause the video and then you can try it on your computer as well. So I'm just going to have a brief discussion about why we use social media to help frame the rest of the talk. So saying, why do we use social media? I'm going to compare social media to other types of technology that we have used and do use and how social media is fundamentally different. So if we think about the telephone as an example of another type of technology that we use, with a telephone, you can go back and forth between two people and you can communicate live. You can send information back and forth live in real time, but you're limited to about two people. So while we have conference calls and things like that, there are practical limitations on. You can use a telephone for about two people. So this is me congratulating my imagination boyfriend, Brandon Flowers, for a great show at Glastonbury last year. So then if we think about another type of social media or another type of communication technology we would use, we can think of the television and how the television can broadcast to a large audience, but the communication only goes one way. So I can shout at my TV, but that doesn't necessarily mean the message goes through. The information comes from, BBC, CBC, whomever, and reaches a large population, but it only goes one direction. However, social media is a fundamentally different technology than anything else people have ever had. So what we can do with social media is have an exponential increase in communications capacity. So not only can we go back and forth live, we can broadcast at the same time. So we can share our message with hundreds, thousands, millions of people, but we can also go back and forth with them. The other opportunity is that the so-called audience of our message can go back and forth as well. So this isn't just an increase, it's an exponential change in the communications capacity that we have. Couple that with mobile devices, and now we're walking around with recording studios, video studios, arts tools, everything we need to create any kind of content available in our pocket. And we never had, the printing press and the book in the same thing. Those were very separate processes, but now we can watch video and create video on the same device. So coupled with so we can create videos, we can watch videos, and now coupled with social media, we can share those videos in an exponential way. This is a fundamentally different technology than anything we've ever had before. So for this reason, social media is here to stay, and I highly advocate that researchers get on board and find ways to make social media work for them. So we may have the rise and fall of different platforms, like Facebook might stop being popular, Twitter might stop being popular, but we are going forward from now always with some kind of social media. It's like if we have discovered a car, we might not all drive Model T Fords forever. Cars evolve, cars change, but we always have cars. We have never gone back to the horse and buggy. And so, you know, I'm not saying that we're going to replace print media or anything like that, but I am saying from now we're going forward and we're going to be using social media in a new way. And the apps themselves may change, but the idea of using this type of communications capacity, that's here to stay. So we're going to talk a bit more about how we can use that to our advantage. So I'm going to talk about Twitter to actually do research, not to promote research. We'll do that as well, but a little later on in the presentation. So to do research, you want to make sure the first thing you want to check out is Twitter the right medium? So there's lots of different types of social media, and they all have different ages and different types of audiences. So the average age of a Facebook user right now is 46. So if that is your target demographic, then Facebook is the right way to go. If you want to try and target 17-year-olds, they are not on Facebook. So you want to make sure that Twitter is the right way to reach the people that you want to reach, whether that be participants, other researchers, other healthcare professionals, whomever it may be. You want to make sure that they are on Twitter. When you are doing research, some people say, well, we're going to set up a Twitter account for the study. I don't think that is the best way to proceed. You can do that, but then you're trying to do two things at once. You're trying to build a following for that account and build credibility by tweeting all the time and doing things with that account, and you're trying to recruit for the study. Whereas I think it's much more powerful if you can create a hashtag for the study. Then all the people who are involved with the study, who probably already have quite established accounts, they can talk about the study and use the hashtag, but not necessarily have to have a person looking after a social media account all the time. So you can create a new account for a study, but I think using a hashtag is a much better way to proceed, because then you can engage with more people. And then you also don't have to worry about at the end of the study, what happens to the account? Do we delete it? Do we get rid of it? What do we do? So I think a hashtag is a better way to go. Twitter is an incredible source of open source data. So there are tons and tons of examples on Twitter, and I'll go through a few of them where Twitter can be the data. It's not necessarily just a means to collect data. It is the data itself. Also, you want to think about how you can use Twitter or perhaps social media more broadly throughout the whole project, not just at the end when you have publications. And so I'll also go through some ways that you can do that, but I think it's much more powerful when you can put social media and get that engagement all the way through the study, so that it's not kind of waiting, and then you have the outputs. You can build that following as you go along. Plus, it also shows the funders, hey, look, we're doing something all the way through that research path. So I think my lighting might get a little weird here as it gets a bit darker. So if I get a two-faced thing going on, we'll have to consider it part of the art of producing videos at home. So one thing you can do when you're using Twitter is that you can look for staff or collaborators. So if you need people to help with your research experience that have specific skills around realist evaluation, Twitter is a fantastic way to find them. Huge number of academic jobs are promoted almost exclusively on Twitter. And so it's a really good place to say, you know, I'm looking for either a collaborator on this project that I could, you know, buy out some time and have you contribute, or I need someone who can work on the full time as a research assistant or something like that. You can also ask questions and solicit people's opinions as you kind of try to shape a study or, you know, refine the scope, see which populations might work. You can ask, you know, are there any research leads at hospitals that might be interested in participating, or are there any veterinary clinics that might be willing to participate in this? And so it's an early way of getting informal input into how a study could look at a very pragmatic level. Now, that's not to say that Twitter, yes, sure, you could be here is the same as having, you know, a research department, yes, but it is a way to get some early feedback as to whether or not something would be feasible. You can also do some early patient and public involvement. There's a few good reasons why using social media is a good strategy. One is that geographically you get a much larger group of people. So I used Twitter for some of my research and was able to, from London, I was able to interview people in the Highlands of Scotland. And they had really rich experiences to share with me that I wouldn't have been able to access if I had only stayed in London. So it's a great way to get kind of more voices as part of what you're doing. Tweet chats are a great way to do that. So a tweet chat is about a 1 hour conversation on a topic. It is hard to get a lot of followers for a new tweet chat. A good way to go is find existing tweet chats and then ask if you could host one. So people are often happy to have guest hosts on a particular topic. So there's We Nurses is every week. There's an Alzheimer's tweet chat every week. There's a healthcare leaders tweet chat every week. So if you, through some kind of looking on Twitter, some Googling, if you can find these tweet chats and say, hey, for 1 week, could I be a guest host and ask questions specifically about my study, then that would be fine. Now you want to share with people that this may be used for research, but also Twitter is publicly available and it's open source content. So people have to know that whether it's used for research or not, everything they see is publicly available. So you'll want to talk to your ethics departments as needed, but generally there's a pretty high level of acceptance for using tweets. So this is an example of someone doing study recruitment. This was a colleague and she said, help me learn more, gave a link to her study, and then also used different hashtags that were relevant to the knowledge community that she wanted to connect with. So this is a great example of using Twitter at a point like recruitment, not necessarily just to share publications at the end. So you can also use Twitter for data collection. So through here, I have a couple of examples for Instagram, just because it showed images more nicely than Twitter did, but you know, any of these concepts can kind of go back and forth between different types of social media, just depending on what you're looking for. So for example, if you go hashtag yoga, you could do analysis of like the first 1,000 tweets that come up and look at photo voice or look at code images for representation or something like that. The example here I have is pain, where I looked at hashtag pain to see what comes up with that. So what you're getting with using hashtags is that people are coding their own data. So we can sort of invert the research process rather than we, you know, ask for interviews or surveys or like ask for the data generation and then we code it. We can provide the codes and see what people have created. So given that there are, you know, millions of pictures taken every day and millions of tweets that are written every day, I think this is a huge data source that is really being underutilized. Twitter has been used to like track influenza outbreaks and things like that. So done correctly, it can be a very reputable source of data and isn't kind of a lesser way to approach research at all. So there's lots of things. One example was that a common hashtag when you have some really nice food and you take a picture of your meal is food porn. So there's been a couple of studies where they've looked at the images that are hashtag food porn and then looked at the approximate calorie content of that food and then used mapping techniques to identify like what is the approximate calorie count of meals in different places and use that as a way to look at obesity or consider, you know, healthy eating interventions and that type of thing. So the sky is the limit with this. Social media can be a great way to pilot test something. So this is an example of a project I led at the Ottawa Hospital when I worked there. So we had quite poor uptake of our hypoglycemia or our low blood sugar protocol. And the nurses who worked in the diabetes clinic wanted to change that. And thankfully, they were really great at recognizing that it wasn't necessarily that nurses were being negligent, but rather it was that we had 3 major sites, I think 7 or 8 in total. We had 24-hour workers, whereas nurse educators are only generally available from kind of 8 till 4 and not on weekends. And, you know, we had weekend workers, night shift workers, we had all kinds of people that weren't necessarily being reached by our traditional communication channels. When we looked at the policy, we also saw that there were examples where it said, give 15 grams of carbohydrate and protein. Well, what is 15 grams? Even as a healthcare professional, I would struggle to think like, I don't know how much that is. I know I have to give them sugar, but I don't really know how much. So these are colleagues of mine. This is not an actual picture of the patient. But what we did was we staged the protocol essentially, and we went through each individual step of the protocol. And so here we took pictures. We went to the ward and took pictures of the exact crackers and cheese and the exact cup and sugar packets that were available on all the wards in the hospital. So that this way, what we had hoped was that nurses would be able to, if they said, my patient's blood sugar is low, oh yeah, I saw that picture that said 3 packs of crackers and a cheese. And so we didn't find that we got a statistically significant increase in knowledge, but this intervention was very well received. And I think that perhaps a further iteration of it, we would have been able to detect different effects with a little bit more sophisticated type of measurement. But anyways, doing something like this is a great way to, you could pilot test something with a lot less expense and you know, less risk than perhaps other methods. So doing this whole project, we put it together in about 2 days. So that was 2 days of work from a lot of people, but we were able to come up with the design and everything fairly quickly. We shot it all on my iPad and launched it online. So compared to the time that it can take to create other kinds of toolkits or interventions, this was a relatively quick win. So whenever you're sharing content on Twitter, you want to make sure that you're using hashtags to help widen the knowledge community that will be interested in it, or make sure that what you're sharing is targeting key people. So here are some examples. There are tons of examples online. I would just suggest, I've got an example here, SMAC, social media and critical care. That's a great way to connect with people, and you want to just check, because in Canada we call it intensive care unit, so ICU. In the UK it's ITU, intensive treatment unit. You know, some of these different wards or different styles of working, like operating room, operating theater, we have like slightly different nomenclature, but there are hashtags for all of these things. They have kind of coalesced around a name for the community online. And so SMAC is social media and critical care. So critical care, you know, you might call the exact place you work differently than someone else does, but that means that generally the critical care community is present there. So I suggest that in addition to having a hashtag for your study, you can have find some hashtags of the people who might be interested in that study as well. So that was Twitter to actually do research. Now we're going to shift gears a little bit and talk about Twitter to promote your research. So Twitter is a lot, and like any kind of online relationship, is like a bank account. You need to put something in to get something out. So if you are nobody wants to have a conversation with somebody who's only talking about themselves all the time and about, you know, their latest project. So it's similar online. If all you do is tweet every 3 months about your work and your publications, it's not something that other people are going to want to engage with. Particularly with the algorithms of Twitter, the way to have your tweets become more visible is frequency of engagement rather than duration. So if you say, okay, we are going to use Twitter or any type of social media as a major part of this new project we're launching, you want to try and be on Twitter at least a couple of times a week, even if it's for 5 or 10 minutes. And even if you're saying something that's not necessarily related to your study, you want to be on there often and gradually building up that base of followers, following more people, sharing more things, and just making your account really reputable so that when it comes time to recruit, you're able to do that quickly. So I'm a prolific Twitter user. I've worked for years to build the followers and that type of thing. And then when I was recruiting for my PhD, I recruited all my participants in 48 hours because I had known how the algorithms worked and built up played my account in the favor of those algorithms by tweeting often, sharing other people's posts, engaging with other people, doing all of those types of things. So when the time came and I needed to sort of cash out, I really did. And it saved me weeks, if not months of time recruiting. So even if it's 5 minutes, I know that everybody's busy. We all have lots of priorities, but it is worth putting the time in. It's also really good to share other people's work, especially if you are a senior colleague. If you share, little Jennifer's publications, for me or for anybody who's in my position as a junior academic, it makes a huge difference and it gives us a type of credibility, much like introducing us at a conference. It's something that we can't do for ourselves and it's a huge help. So if you are a more senior person, don't be shy to share the work of more junior people because it does us a huge favor. But it's nice to share other people's work too. I know sometimes there can be quite competitive attitudes about things in academia, but I don't buy into that at all. The world is full of problems and no one person can solve them all. So we may as well all work in our areas of interest and expertise and try and bring the tide in to lift all boats, if you will. It also provides an opportunity when you're sharing your research findings to share with the service users or share with the people who have participated in your study. I think it's important that they have a right to access the information that we generate. And the European Union has now said all publications that they fund must be open access. So you can provide a measure of open access either by linking to open access publications or also sharing like tweet length headlines from the findings of your study. So having a short, clear key message, and you can have lots of these if there's lots of key messages in the outputs that you want to share, but don't be too technical. You want to be very focused. So breastfeeding rates remain low in the UK with a link. Perfect. That's all you need to say. And then if you want to, in subsequent tweets, you can share more detail about, maybe it's more prominent with women outside of London, or maybe it's more prominent with white women instead of Black and minority ethnicity women, or whatever the case may be. You can explore in more detail. But your main headline should be exactly that, a main headline. Hire a graphic designer. There's lots of people from the arts that are amazing and happy to contribute. Hire them from day one, even just for a few hours on the overall time on your project. Because when you have beautiful, stunning images, they share so much more easily. And, I can bash something around on PowerPoint for a while. It never looks as good as what professional graphic designer can create. So I suggest, if at all possible, give graphic designers the love and the funding, and they will create amazing things for you that will share your message exponentially more. You also want to tailor tweets to different populations. So rather than say, well, I just don't want to tweet, my study is done 8 times. Well, tweet once for policymakers. So you could say something like, the main policy priority from my study is that we staff for all nursing work, not only based on patient census. The clinical piece could be nursing work includes more than tasks. Tweet for your funders, you could say thank you to CIHR for funding my research. The impact it has made has been engagement with this many people, sharing with this many facilities, whatever the case may be. For educators, you could say the number one thing to teach nursing students is that nursing work has different dimensions and not all of them are visible, and that documentation is just as much legitimate work as washing a patient. So anything like that. So those are just very kind of off the cuff, but those are quick examples of how from my PhD, I could have different tweets tailored to all those different populations. So that way you're not saying the same thing over and over and over again, but you are promoting your work consistently to different audiences. So this was an image that was an artistic collaboration with a designer that I used in my study, and it's just so beautiful. I could never manage anything like this. But it shows different types of nursing labor, and in a glance you can tell there's 4 of them, and that, you know, with a little more depth you can see the different what they could include, or it gives you a little bit of a hint as to what's coming in terms of the reading. So this was money well spent, and I suggest having something like this that you can put on a tweet is a huge branding opportunity for the work that you do. So this is another example of what makes a good mentor from Pam Smith. I took a little screenshot of a table that was in her study and then put here PhoneEd, FOAMed, and MedEd, which are free open access nursing and medical education, and then MedEd is medical education. And so mentorship is a common topic looking at, you know, education of healthcare professionals. So I had a link to the full article, quick question or a key take-home point. I attracted a couple different knowledge communities with the hashtags, and then I shared the image that had most of the content in it. And so Pam Smith is a personal hero of mine, and she did some great work, and this was an opportunity for me to share her study to my followers. So something like this has lots of different elements in there, but in one simple message, you can convey a lot of information. So how do you keep from repeating yourself over and over again? You can write tweets and then use the quote tweet function to target specific people with your message. So here's like a base tweet that I used for my PhD. And then if you hit quote tweet, you can say, this is of interest to ICU nurses, WHO, whomever you want to put in, whatever key groups might be interested. Or you could say in the quote tweet box, you know, Pam Smith, could you retweet this tweet? So then that way you have one tweet that you can kind of leverage all over the internet, but you can also target individual people. So that quote tweet function, rather than just a straight retweet or a retweet with comment, means you can still do that over and over and over again, and it gives you the possibility to put in lots of different names. So if you retweet something, you can only do that once, but if you do a quote tweet or a retweet with comment, you can do that over and over and over again. So it's a great way to still spread the message far and wide, but save yourself a little bit of work. Another thing you can do is use a thread or threading technique of like using multiple tweets. So you've got kind of your headline flagship at the top, and then you can share different points or provide more in-depth commentary for people that want to see more. So it's a way of having like a slightly longer presentation on Twitter, but also still in very kind of bite-sized pieces. So that's a good way to get people's attention and to share your knowledge with them. It's also a good practice to if you have a hashtag, there's a community called Simpler. You'll see here SYMPLUR. And they offer a lot of things that you can pay for, but one of the free things that they make available is a healthcare hashtag repository. So if you register your hashtag with them and say, this is the hashtag and this is what it's about, they will automatically generate some data for you about how many times that hashtag has been seen, how many people it has reached, how many people have clicked on the links. And so you can get that information manually off of tweets, but then you have to add them all up. Whereas what Simpler does and other types of technology like that, they show all of the tweets with that hashtag, their net impact. And depending on if your tweets are effective, we did Twitter conferences with nursing students, and it was one group of students during an educational seminar for one day, and we could usually get about 400,000 impressions. So that's 400,000 different accounts that have had those tweets show up on their timelines. So showing someone an image that says we had 400,000 accounts see our content is a very powerful way of persuading funders or demonstrating impact and doing that kind of thing. So take a few extra minutes and try something like that, but you want to have some way of recording the impact that your tweeting has, because then it becomes more credible. You can also do some really innovative types of dissemination. So these are some examples, again, from back when I was working at a hospital. So I did a day in the life of different types of nurses or different nursing roles. And so we live tweeted, and these were the first known live tweets of nursing work. And so sometimes I had people do them themselves. Other times I would follow nurses around and just tweet what they did all day long. And, there were initially a lot of concerns about that, but in the end, we didn't have any ethical or privacy violations. We had lots of great engagement, and then people who were saying, I might be interested in being a clinical nurse expert, or I might be interested in being a nurse educator, but I'm not quite sure what it looks like. Well, we had these great marketing tools to say, this is what the role is, and this is what it includes. And so that didn't cost anything except my time. So it was a great way to share information. This other image we had was one taken from the archives. And it was part of our Throwback Thursday campaign to show how nursing had evolved. And it was just incredible to have different images from nursing and share different kinds of things. So there's a lot of ways that you can be really creative about sharing information, and the internet loves this stuff. And so it's a good chance to embrace, a lot of healthcare is art and science. So this is a great chance to embrace some of the art in that as well. Twitter is also fantastic for networking. Scholar Sunday is the brainchild of this researcher, and has a huge following every week. And so there's lots of different academic communities online, and they discuss things like, how to manage student evaluations, how to use different types of assessment, what are the benefits of flipped classrooms. And so in addition to the published commentary on those issues, this is a nice way to get anecdotal or lay experience information as well. Other tips, talk to your comms officers. Every faculty probably has one. They're happy to help. They want to share things and they want to see your success promoted. So don't be shy to be in touch with them. Use images whenever possible, and to avoid any copyright issues, there's a website that I've listed there, unsplash.com. All the images on there you can use for free, and photographers have offered them without any copyright, and they're beautiful pictures. They're so much nicer than any sort of screen grab of Google images that you could get. And so you could take those pictures, using simple software, you could add words onto them or anything like that. So a few minutes up front, making really nice images that are really eye-catching and attractive will mean that you will get that much more benefit when you share that message later on. So if you're at King's, you follow the King's communication guidance, or at any other organization, I'm sure that there is some type of social media or local guidance, and I suggest you seek that out before launching into any type of social media campaign. And a friendly reminder, plan for outputs or plan for using social media throughout the project, and you will get so much more out of it personally and professionally than if it's only a way to share the final product. So you can see my Twitter handle there, jjackson_RN. Give me a follow. I would be happy to follow you as well and see what you're up to. So I hope this video has been useful, and if you have any questions, feel free to either leave them in the comments or tweet me, and I can either do another follow-up video if there's lots of questions, or happy to get back to you in another way. So use this to your advantage, and hopefully I'll see lots of great content online. All right, thank you very much. Take care of each other. Bye.